Hi, everybody. We're going to get started here in a few minutes. Just turning 6 o'clock. It's hard because of traffic and everybody running home. And then we also know you guys have other things to do. So we want to kind of keep this moving a little bit, but I feel I might want to wait just a few more minutes, and their numbers are going up still. So we'll just a couple more minutes and then we're going to get going. For those of you who are newer, the Q&A is the only one that's going to be allowed for you guys to chat with us. Any questions are fine. No one can see them. I'm the only one that can. So if you're worried about, privacy, your name, anything like that, that is not an issue. Numbers are still going up, so we'll just wait a few more minutes. So in other words, when you're touching the bottom of the screen, the chat is not enabled. So we're gonna let you know that, and still going up a little bit. So I just hate to start and then people are going to start asking questions of things that they missed. It's just really tough sometimes getting your connection or things like that. God knows when I'm at home, I can't do it. The only way I do it is with Nina. She does everything for us here. And without her, I don't know what I would do. So she does all of our photography. If you guys come in and we make you get your picture taken for the 300th time, that's sweet Nina taking the photo. I know she's always like, oh my gosh. So today we're going to be talking about Ultherapy. I don't know if any of you guys have been on before. I have lovely Sherry with me. She is from MERS, and she's going to go over some of the things that have to do with the procedure and also answer questions from a corporate side if there's something that you guys want to know. And so I think maybe, it's maybe one more minute and we'll get moving. This can also, I believe, be emailed to you. So if you have to go, if something happens, if you lose connection, we can send it to you. The specials are going to be at the end of the presentation today. They're very similar to what I've done in the past just because they've worked. I did add a live video of the procedure being done. It's pre-taped, of course. One of my patients was so nice to let me use her, and I'm so thankful for that. And she did a really great job. I explained what Pronox is a little bit. And I'm also going to go over the actual procedure because a lot of people weren't understanding that when we give away the free lines, it literally does mean a tiny little line of the energy that is delivered to your face. So they're little thermal coagulation points, and you'll be able to see that when we show that. So I think we're going to get going. The numbers are still going up, but that's okay. So we're going to talk about, I can just, I need to go to this little thing here, right? Touch this. Okay, now we got it. Okay. So it's not big enough though. I don't think. I think it has the edges still. More time. There we go. Perfect. Okay. So again, I am Jill. I work with the Parker Skin and Aesthetic Clinic. I don't know if people are still logging on because now I can't see that part. And this is lovely Sherry. She comes with me to be able to answer some questions and help me with the presentation, a little bit of just explaining Ultherapy in general. So for me, it is still a gold standard for all of my patients. I really, really love it. And the reason for that is that it is non-invasive. It does have the indication from the FDA for lifting and skin tightening. I think that's really important. And it's also a dual plane, which I'm going to explain later in the presentation, meaning it touches two depths. And I think that is really what sets it apart from all of the other procedures that you can do. So I guess I can let you, do you want me to let you talk? Yeah, let you take over a little bit.
Thank you for having me.
You're welcome. You know I love you.
Look forward to this every year.
Oh.
But again, I'm Sherry Quinn. I am the Ultherapy rep and trainer for the treatment, and I've been working with Jill for quite a long time. And if I don't know, she's my go-to. So I have to tell you, you'd be in great hands if you choose to get a treatment done here at the Parker Clinic because she is the OG. She's been doing this forever and she's super good at it. So, but I really wanted to touch on collagen and what it means and what this treatment means for your collagen. So after the age of 20, we lose about 1% of collagen a year. So, and collagen is really the secret sauce to keeping you looking younger. What it is basically the scaffolding underneath your skin. So it's going to hold everything up and keep it nice and lifted and tight. So as we start aging, that starts to weaken. And then as that starts weakening, we really start to see the laxity in the skin, lines and wrinkles. And what this treatment is doing is it's stimulating collagen to renew. So it's really kind of like regenerating the collagen that you already have, but also creating new collagen, which is super important, especially if you're, you know, up over into your 40s and you're starting to see that sagging.
Here we have some nice, you can see the different ways that Ultherapy works. As you start to see some underlying changes in your skin and things like that, that's one thing that people say to me, I don't know which procedure to pick. And one of the things is that they all can kind of build on each other. So when you talk about a younger face or, you know, just starting to show aging and things like that, this is really nice because it does lift your skin. So in other words, it's going to pull the cheek back nicely, which also helps underneath the chin. You will hear my patient talk about that a little bit as things move forward. It also helps with the hooding of the eye. One of the first indications it has was a non-surgical brow lift from the FDA. And that was really, really great because, you know, as we age, one ocular side will tip a little bit more. So we can also treat a little bit more on the right side or the left side if you have a lid that might want to sag on one side a little bit more versus than the other.
So it's good for balance.
It is.
Really good for balance.
Yes, thank you. You can go ahead if you want to.
So like I had said before, like weakened collagen fibers is really what is contributing to the sagging as we age. And how this treatment is actually working is through ultrasound energy. So what it's doing is it's creating these little micro-focused wounds into our collagen with heat. And as it starts healing is when we really start to see that lifting and that firming of the skin. It takes a little bit of time, not a ton, about 3 to 6 months when we really start to see the, I would say, like ultimate like benefits of the treatment, really. So you do kind of feel like a little lifted and tightened like right after the procedure, but really as time goes on and that collagen is rebuilding is when you see the best results.
When you look at the picture in the top and the picture at the bottom, you're seeing those kind of spring back up to life as things want to sort of shrink. So again, when you're talking about doing fillers and things like that, if you had a bigger depression in the tissue here, it's going to fill a depression, sort of like a divot on a golf course. Ultherapy can't do that. Fillers do that. But when you have that underneath spring back, you're then putting a filler on healthy tissue again, which is a much nicer outcome for people.
Sure. So again, Ultherapy is the gold standard in lifting and tightening. There's a lot of treatments out there that will tighten, but not lift. We're the only ones that do that. And again, it's through ultrasound, tons of clinical results, FDA approved, which I think is super important because to get FDA clearance for something, it has to be safe and it has to work. Those are the two things. And we've seen a 95% patient satisfaction rate.
Yeah, we have. So now we're going to see a little video here of one of my patients. We'll let you look here for a second.
Hello everyone, this is Carmela, and I ran into her the other day and she was very excited to tell me how she felt about Ultherapy. She was also talking to me about some of her family members and friends who have also had the procedure that have experienced some of the same things happening with their skin. And I invited her today to be able to speak to you from her heart about how she feels about Ultherapy and kind of share some insights on the procedure. Thank you for coming in today. I really appreciate it. And I figured I would just let you talk without prompting you to say anything. I just want you to sort of say what you said to me and you were excited when you saw me, if you can do that. Okay?
Perfect, yeah.
All right.
So the first time I wanted to do the Ultherapy was because I noticed that the skin on my eyelids were getting a little saggy.
Yep.
I put eyeshadow on and the skin would move and not go back, and it was kind of droopy. So I had spoken to you, what can I do that's not so invasive?
Yes.
And you had mentioned that it would open my eyes.
Yes.
And it did. It really did lift up my eyebrow. It tightened this. I felt like I wanted a little bit more, so 6 months later we did it again.
Okay.
And that's when I really noticed the results.
Okay,
That
very
it
good.
really opened it up.
That's typically because they build on one another. You remember we spoke
Yes,
about that,
yeah.
and you were very excited to hear
Yeah.
that the results of Ultherapy doesn't necessarily go away. So you were excited to try it again. So that's
Yeah.
very good. Okay.
And because I saw those results about a year and a half later, when I would catch my reflection in the mirror,
Okay.
I started noticing this
Under
started
your chin.
sagging.
Okay.
And So that's why I had come back this spring to have that done.
Okay.
And I know the results don't happen right away, and it did. It took a couple months, but now I do notice, because you did my lower face and my jawline, how much that's tightened up.
Okay, great.
And other people have noticed.
Oh,
So
that's
that's
great.
how
Yeah.
I started recommending some of my friends and family to come here, because they also noticed the results.
That's wonderful. Thank you.
And I do think it helped. I'm 54, but
So am I.
yes, we're very close in age.
Very close in age.
But I started doing the Obagi new derm line when I was in my 30s, when I was
Yes.
32. So I feel like I've always prepped my skin.
Definitely.
My skin has been in good shape.
Yes.
So I do get really excellent results with the Ulthera.
Yes. And I should also say you've had barely next to any Botox and filler.
Right.
Anything that you would have is gone. And the one thing that I think that people, when I've been with you, say, my gosh, you're aging backwards. What are you doing? And you and I kind of just privately chuckle because we don't always tell anybody. But I think it's really awesome that at 54, as I'm the same age, it tends to keep you from aging quicker. So some of the before and afters that you were so nice to let us show are going to show that we've sort of stood time, time has stood still a little bit for you, which I think is what a lot of people sometimes are looking for when they're just getting into the arena of trying non-surgical, processes. They're maybe afraid of different things. So I think this is really done a great job for you, moving you slow, which is awesome. And so many people don't want to look different.
Right.
They just want to look like a really good version of
That's
themselves.
exactly it.
And
Yeah.
I remember you saying that to me.
Yeah.
So
Yeah.
thank you so much. I really appreciate you coming today and letting people know how you feel and letting us show your before and afters. It really means a lot. So thank you.
Oh, you're welcome. Thank you.
Okay.
Okay, so now we're going to go on to the next. Thank you again, Carmela. You always are so sweet and help. So when we're looking at this one, you guys are going to get a better image of this, but this is really, when you're looking here, you're going to see a 1.5, you're going to see a 3.0 and a 4.5. Those are the depths of the collagen levels that we can get to. And everybody has a different plane. Everybody has a different availability depth of collagen, and it runs all the way across. So when we talk about those little tiny thermal coagulation points that look like dots, we're treating it at different levels of your skin each time. So the brow might be not as deep as the cheek and things like that, but we do customize it to you now. So Ultherapy has changed. If you had it in the past, it's a little bit different now for the last couple of years. So here, I think we're going into one more quick video that's going to explain the thermal coagulation points.
One thing that I think is very important, when we say we're giving away lines, this is what the lines look like. I don't know if you can see how
It's going to get a little
that is.
closer.
Those little bitty dotted lines that are on top of this measuring stick. So when we fire the Ultherapy, we are actually turning on a line that goes from here to here on your face, and it's very, very tiny. It's one tiny little bitty line. So actually, if I fire it into this plastic, you're going to be able to see it on there, but it's very tiny, like see-through. I don't know if you can see how tiny they are, little pieces. So those are little tiny dots or thermal coagulation points of the end of the sound wave. So when we say it's ultrasound, you think of a sound wave traveling and you're getting one line of energy at a time. So typically the face is all mapped out here behind me, although we do customize it to the tissue of each patient, which again, I did say a little while ago, it can be different on each cheek, under your chin, your chest, your forehead. So you want your technician to understand the depths of the skin. One thing that I think is very important.
Okay, so we're going to talk about Ultherapy and how it boosts your collagen, and it is really all about the science. This diagram is really interesting. I feel like, I'm sure you think so too. I'll even let you say some things because I think you probably talk about it a lot at all of your different places. I think it's nice because it actually lets you see the different depths that the different procedures can get to. This is a big one here for me that you probably can't really talk about. Radio frequency is another option. I think it's nice, but again, you're talking about only heating the top layers of the tissue. And what you have to understand about that is that you guys have to be able to take the heat for a specific amount of time to get it to the temperature that we need it to be. Where Ultherapy is a little bit different. You've got the 3 different choices to choose from. And I feel like because you're always doing it at least on a dual plane, meaning you're doing 2 depths, I feel like that's where that tightening and lifting indication comes from. But I'm sure there's things that you want to.
There are.
Yeah.
Radio frequency is an awesome treatment in correlation with, I think, even all
Yes.
therapy, because it is more of a superficial treatment. So it's going to be more like on the surface of the skin. So it's really going to be able to help with, uneven texture,
Fine lines.
fine lines. It's wonderful. But again, it's not going quite as deep and it's not getting quite as hot. So, it doesn't have the capability to do what Ultherapy does. It's awesome in its own category too, or even partnered with Ultherapy.
Yes. So here we do have Thermage, and we also have Secret RF. I find that Secret RF is quite nice. Annie and the physicians all use that. It's really, really nice. And I think they partner together. And it's kind of the same as if you're doing the Botox and filler and you want to put it together with some of this collagen remodeling that you're getting on a deeper. Oh, go ahead, Beck.
Just one more thing.
Yes.
If you notice too, even on this diagram, that Ultherapy is going just as deep as a facelift.
Yes, and that's on the 4.5, which is nice.
It's going just as deep as that facelift, but it's not invasive, and it's
Right.
not, if you're not there yet.
Right,
So
exactly.
it would be,
Right.
but it is doing a lot of the same things.
And I will tell you, some of the people that have done it younger are the ones that are going to have that 4.5 depth available. Always typically younger. I've only ever seen one person that I've helped in my career, and I've done probably thousands of these now, that I only was able to treat her at a 1.5 depth. And it's only ever been one. So I probably will not really have many in my career. So it's just kind of interesting. Actually, some of my Asian customers that are absolutely beautiful. I mean, I always say to them, like, I don't know what you're trying to change because your skin is so perfect. They really just do not want their skin to change. And I think long term, it's something that they just really, really love. And they're so, they're doing all these really great things that they come up with. And so they always love this procedure. So you can go ahead if you want to talk a little bit about this one. Do you feel you want to?
Oh, they're talking about the
Laxity of the skin. Yes. So we're talking about jawline underneath, and then after it'll kind of tighten, which is something that Carmela had said that you could see for her. Here you're talking about the neck. Now, the one thing is when people come in and want their neck done, you do sometimes need to do this lower part of the face, because that will pull that part of the face back, which also helps under the chin and the neck a little bit. It's all connected. And as we age, we talked about that ocular eye area tipping a little bit. It also tends to have the cheeks and things like that slide down just a little bit.
And I think with this one too, it's like showing like that top, patient is obviously a lot younger. So that's like early signs of laxity, where the one below is more an advanced stage of laxity. And you can definitely see that in those pictures. And even like the top one, that jawline is so much more defined. And,
Yep. And, I mean, it's really up to you and how you feel in your heart about it. Some people are like, I will never get surgery, so I want to do the best that I can do to make my skin, the best it can be. And like Carmela said, using Retin-A's, doing things like that to keep your skin as healthy as it can be, makes everything that we do here look good. And that's also something else that I specialize in. This one I think is going to be the demo of her actually getting it done. So I may stop partway through. I think it's like maybe 13 minutes long. It's not super long. And then we have a couple more slides, and we're going to go ahead and do some Q&As and then talk about the specials and things like that.
So when we're measuring the patient's face and the depth of which tip we're going to use, we want to just first sort of see the tissue and come up with the treatment plan, and then we know what we can treat. So if I freeze it here on the screen, we can talk about it a little bit. So when you see here, she has a lot of beautiful live collagen that we need to stimulate. She actually has a little bit here and then a whole lot at the surface. To the side here is where we're measuring the depths. So for Carmela, we want to wake this bottom tissue up because it's so bright and healthy. Patients have different areas of their face that we're treating, and there's always going to be different availability of that collagen within those areas. So we critique it to each patient, which is more of a customized approach than what Ultherapy had in the beginning. So I think that is really what sets it apart. You've got your two levels that you're going to choose from. So one could be the top, one could be the bottom, and you could also treat a little bit in the middle, which in theory would then be 3, but there are calculated amounts that you can do in each level. So today we're going to actually start with a tip that's a little bit deeper on her, and I'm going to let you see that. So when we place the transducer on her tissue, you are now seeing that 4.5 is going right through her collagen and waking everything up to make everything spring back to life in her cheek. So what happens with patients is that you can actually have it different in your submental area and differ from the right cheek to the left. So you really need somebody that knows the tissue and knows how to read it properly so that you're getting the dual plane and the proper depths customized correctly. Let's have a quick little talk about the Pronox. Pronox is a light pain reliever. So it is in our office, it is 50% nitrous oxide and 50% oxygen, and it is monitored by the physicians that are here in the office. So prior to administering anything like this, they have seen the physician usually twice. We can also give you pain relievers, which would require a driver. Carmela typically chooses to do it with just the Pronox, and when you have something like this, what's happening is the patient is in control. So she's putting it in her mouth. You can sort of demonstrate if you'd like. She's taking the Pronox down into her tummy like a deep yoga breathing. The most important thing is that she's breathing in and out through the tube so that she is not giving it to me. You can go back and forth several times, typically 3 to 4 breaths of it. The patient is very comfortable and we can continue the procedure. The doctors will tell you if you are a candidate for the Pronox here at our office. And most patients find this is really easy to do because you can leave within 20 minutes of finishing the procedure and go ahead and drive yourself home if we do no medication with the Pronox. Most patients tend to do that. So I'm just going to loop around here, Carm. You can just do what you normally would do. And we're going to take a look at the forehead now. So typically when patients come in, they really want this nice little brow lift. Again, you can see on the screen, just like we saw on her cheek, where that beautiful collagen is showing and the level that we want to hit. Also on the forehead, it is going to be a dual plane. So we're going to do the middle and the high plane for the skin here to raise the brow, which is what she was talking about earlier when we talked. She said, I really liked that some of the skin lifted up off of my eyelid, and that's because her brow was actually raised nicely. One thing that I do like to say to patients who love to have fillers and Botox is this really keeps your own tissue regenerating, and the Botox and the fillers add to that glow and that beautiful, youthful look. This procedure cannot fill in any, if you need under eye filler, if you have areas in your chin maybe that you wish that were a little bit smoother in this area down at the bottom of the face, typically that's going to require some filler, but we can always lift the cheek very beautifully with procedures like this. The other thing that's nice about the Ultherapy with Pronox is it's completely controlled by you. These tubes do not blow the medication and the oxygen into your face. If you're not pulling it out of the tube, you can just gently hold it in your hand if you're comfortable, and you don't need to use any of it unless you feel at that time that you would like to and you need it. Typically the forehead's a little spicy. We've got very thin skin on top of bone, and we have our little nerves that travel across the top of our head. So it can be a little bit spicier for some patients, but you don't need very much up here, and then it's done, which is great. So it's very quick to be treated versus the cheek area of the face. So now we're going to show you this little side here we're going to do. This is when we smile and we get some soft little crow's feet that can also have Botox. It's very easy to have done. As you see, she is continuing with her Pronox. She has used it in the past and feels very comfortable doing so and understands it, and if she needs to at any given time, she can take the tube out of her mouth and communicate with me and is totally fine. Like she stated a few minutes ago, I feel warmth, but I don't necessarily feel pain. I just feel like it's warm, so that's really good for patients to know. So here we can treat this area around the ocular corner to really help with some of those fine lines that we tend to want to get when we smile. And they can also be frozen quite nicely by the physicians with the Botox. We're now going to do a little treating under the eye, very lightly. So these, people ask me this question all the time. These tips were designed for the eye area. They have a nice little angle to them so that they can fit near your nose and in those delicate areas that are tougher to get with the larger tips. So she really feels that this has helped her a lot over the years. And again, you know, keeping in mind when your skin is in such beautiful condition like Carmela's is, all of the treatments that we do to you look better. Your skin has such beautiful spring, and even though we're in our 50s and I have had a hysterectomy, so that can also, you know, mess with the collagen and elasticity of your skin. So we want to do things that's going to pump the collagen back up, and Ultherapy is a wonderful procedure for that. Again, reminding you that it is on a dual plane. We're not just treating one depth, we're treating two. So far when you've seen me treat this right side, this has all been on the 7.3.0 depth. So now we're going to move up to the 1.5. And that will be considered the 2. This tip is a little higher in the tissue. It can tend to leave a little bit of redness, a tiny bit of maybe what could be considered to look like a soft little hive for maybe 20 minutes, 30 minutes. Typically by the time I treat the other side of your face, they're already gone on the side that I started on. So this procedure is really considered no downtime. You could get a bruise under the eye depending on if you're on blood thinners or your tissue is thin, things like that underneath the eye, but it does go away quite quickly. We have a laser available that you could come and see the doctors for if you feel like we really broke a little vessel there and you ended up with a blacker, tougher bruise that was going to take a little longer to go away. So now we can see we have just completed the small under eye tip here. Like I said, it fits quite nicely under the eye area, and you can see that she's ever so slightly red. Very light, nothing to worry about. So we're going to continue on to those crow's feet area now, where we do tend to see when we smile. So we're going to treat that, and then we're going to go ahead right up to the brow, and this side of her eye would be considered completed. So it's quite quick. The bottom of the face needs more lines. You have much more tissue down there that we need to lift, so that because this is a little thinner and finer, it can go a little faster. You can divide the areas out. Typically what I tell you to do is lower face, which would be like under your eyes down to under your chin. This would kind of be considered lower face with the submental included, and then your neck would be where submental meets your neck down to your collarbone. Typically patients feel very comfortable. Again, this is considered the dual plane pass, meaning the second one. So we are higher in the tissue where you're going to see a little bit of redness. Nothing crazy. She could put a little teeny bit of powder on, go to yoga, and go to the grocery store. You will not notice that you had anything done. And like I did state prior, you could get a bruise that is very hard to judge. It can happen from really any procedure that we have. So that would be the biggest consideration, I would say, of downtime would be a bruise. So now we're going to go back up to the brow, and this would be considered her second pass. We'll just have to sort of see. It depends on how you feel about the procedure yourself. Everybody's a little different.
Oh, I moved back.
So that pretty much completes our live demonstration. And again, all of the indicated areas that you can choose are your eyes, your lower face, your neck, and your chest. And then we do have some off-label treating available as well. We can discuss any of those type of things at your consult.
Okay. So now we're going to go, again, this kind of gives you some idea of how they map out the face to give you ideas of what you can treat. So when we were treating Carmela, the first thing that we saw was the 4.5 depth that you saw when we were talking about that bright collagen that's in the bottom. So some people will say to me, well, you know, I've had a hysterectomy or I this, I that. I don't know if I'm going to have the collagen available. And most people do have some in the 4.5 zone. And so even if you don't have enough for me to do the entire amount in a localized area, I customize it down a little bit and then I move up to the next area to finish that configuration. So it's kind of confusing, but I can explain it to you guys when you're here a little bit better if you want to see it on the screen on your own face. I don't know if there's anything else you want to say about.
Yeah, I just wanted to touch on a huge point of difference that I think Ultherapy is really known for, and that is the visualization.
Yes, for
Because
sure.
a lot of other treatments, like you're just kind of going in blind and you're basically treating everyone the exact same way.
Yeah.
Where with this, because it's an ultrasound screen and we can really see where your collagen lives,
Yes.
and everyone's is going to be very, very different,
Yes.
or even just different in different areas, you're able to really customize it. So that's where the whole customization, I think, comes from, is being able to really be able to see exactly what needs to be treated. And
yes, very good point. Thank you. It's kind of what I've been trying to say the whole time, but you pointed out the difference. I'm sorry. But I will say too, what's really great about it is, you know, knowing, like, let's say you had it with me 5 years ago. I don't necessarily look on your chart to see exactly what I did. I go by how you are now, what you're asking for now, and quite frankly, your tissue changes. So, you know, even if the 4.5 is not available and the 3.0 is available, which is the one in the middle, it's still considered your deep tissue. So that's what she's trying to say, is that when we're looking on the screen, there's a reason we're waking up the specific collagen to your anatomy. So here how you can see some of the befores and afters of some of the hooding of the eyes and things like that, which I think are so nice. It does kind of add to the Botox effect. It will tend to lift some of this off of the edge, which was something that Carmela was happy about, being able to see her eyelid for when she does makeup. And again, you're going to see that 86% of patients thought that they had a brow lift. They had a really good experience with that. Here's some before and afters for under the chin. It also helps with some of this area here, which I think is so nice. Also a little bit there. I think as you're going along here and the jawline, you are going to end up with a nicer, little bit more defined of a jawline. I have done a couple of gentlemen that felt like they just had this here and they were quite younger and it really bothered them. It was something that their moms or, you know, family members had smaller guys a little bit, and they really, really loved that they lost this area. You know, they didn't want to have to do liposuction. They didn't want to have that starting to hang. So I think that's something that really helps. These are all female, obviously, but I know that I can think of a few, like 3 or 4 of them that have done it, and they're really happy with that. Also that submental area underneath their chin. So these are just some of the before and afters of that. And then you're going to see the next These also do vary. I had been giving you guys the neck creams with the neck treatments, which we do have again this year. And a lot of people have stated they loved it so much that they bought it again. So I thought that was really good. And Sherry did give us those. So thank you very much for that. And the patients are coming back to purchase it, which is wonderful. And they're really liking it. They are. I mean, when you're looking, they are. And I know Carmela had felt like her neck really had gotten better underneath, you know, as well. So that's a really good thing.
Do you think that the neck is the #1 trouble area for most people?
Probably. And I think, you know, you really need to be using your retin-A's. You need to be using all of the products that you can down there as often as you can. Your neck's going to always give you a harder time than your face. It's just the way that it is for most people, but trying to make sure your sunscreen is good there. You know, if you're going to do laser, try to maybe add your neck in. When people get microneedling with me, I always say, would you like your neck? So typically the assistants will numb you from your collarbone up, and we treat your face and your neck. It just matters. Yeah. And Ulthera has made a big difference.
Stop with all of our skincare. Like
we do.
Take it down to the neck.
We do.
In our neck either. So when we start to get that sagging, it's really going to sag. There's nothing for it to hold on to. So it's a very, very, very popular area that people are
definitely
treated.
Yes. And when we talk about, you know, the lines that you can get free that you could use on your décolleté, if your décolleté is fine and you feel like you don't need them, then we take the available lines here and we just move them up. So when you're typically, if you do a full face and a neck with me, I give you your chest free. And some people say, well, my chest is great, I don't really need that. So you can then take those lines and move it to an area that might have a little bit more laxity, such as this lady here. We would maybe need to do a little bit more of a treatment for her than a standard one, just to kind of give her a kick in the right direction to get everything moving. And here's where they're just speaking of the décolleté. So it's typically under here into like a V. It's almost like a triangle that's backwards, upside down to the V here. And we can get low a little bit in there between the chest area. So I do have people that really like it. I mean, it's something that's non-invasive. You know, for me, on some of these photos, I also feel your skin quality would have needed to be improved if you were a patient of mine. So I would have you on retin-A's. We would be doing peels. Retin-A's and peels can really do a lot for you. And then if you need a little bit more, the doctors can amp it up with laser. Laser will also add some skin tightening, but you're not going to have that dual plane of collagen choice when you're doing something like Ultherapy. It's going to give you a different. But I think here, just even there's some sun damage on these chests that could be taken care of as well. So I'm just being honest about that. But I do think that it would really help. Oh, and then you saw that real quick photo of Carmela with just a little tiny bit of what I call like a little bit of a raised hive. And then it's red. Typically, by the time I'm done with the one side of your face and go to the other, only one of them is red. So you see just a tiny little bit of like downtime, but you're always gonna, I think first you feel the tightening, and then you can, like, I know some people say when they yawn, under their chin aches a little bit. It's not really painful, but you do know that you did something. I mean, people will say, whoa, you really got me. I mean, it was good. I didn't feel it at first, but then I was like, wow. The other thing that people do say is they feel itching. So I think it's while the wound's underneath, it's a deep tissue damage. And as your body is creating that wound heal response, you do get itchy. So not bad, but you can feel it. So it's just something to kind of note there.
I always tell people too, like, that's a good sign.
It is.
That's a really good sign, because you really want that inflammation. That's mean that we got in there and we did what we were supposed to do, which is to really create those wounds in the collagen. So I'm always like, if it's a little achy or a little sore, then that's good. Great results.
Yeah. And what's nice is you don't see it, you can just feel it. Right. So you can get a bruise. I mean, you really can, but not always. So again, we've got the brow lift, we've got the face, we've got under the chin, which is called submental, your neck and your décolleté. It improves all of those areas, and we can talk about off-label treating as well. I'm going to go to some of the questions here. So here's some of the, you guys can maybe screenshot this with your phone. If you do full face and neck, you'll get your chest free. They do not have to be on the same day. I usually have them within like 2 or 3 months of each other, just because, you know, we kind of keep it on the same track. But that way, you know, you can get the chest free. Chest typically is around $1,100. So you would get $1,100 worth of Ultherapy somewhere else if you feel that you need it, or you can save it and we can do your chest. You would do Pronox 2 different times if you did 2 different visits. So typically maybe we would do under your chin as continued for full face. And full face is anywhere from 3,200 to 3,500, depending on what you need and what all we're doing. Your neck is anywhere from 1,600 to 1,800. It just depends. And then your chest would be free. If you were paying for that, it would be 1,100, and they can be divided. So full face or lower face, you get your eyelids or your lip free. So under the eye, sorry, not lids, under eye. So lower face is typically here and down and underneath your chin. It's probably 2,800 to 2,900. It's just hard to know exactly without mapping out and seeing your tissue, but that's like an approximate idea on that. And then we would give extra around the lips and extra under the eyes that would be free. We do have the eye creams while they last. We have the neck cream while they last, which are included in the free. We're just giving the free lines because it just gives you a little extra of the treatment. And so
amazing value.
it is a
It's
really,
good
yeah, it
value.
really is. Under your neck and your chin, you would get under your eye free. So I kind of do the crow's feet area here and then up underneath the eye. I do have some appointments this coming Saturday open, which is unusual. I'm not always here on a Saturday. Dr. Parker is here and I only have a couple scheduled right now. So I just wanted to let you guys know about that. I'm doing consults free because you attended the webinar. And then typically when you schedule, they do take, I believe they take $1,000. Don't hold me to that. I'm not super good on the desk. They're so amazing out there for me. And then, you know, you need to schedule by November 30th and have your treatment completed by February 28th to take advantage of these. And so I don't know if I have anything after. I don't think I do. So I'm going to try to get back to the, so you can see us. How do I do that? I know, right? So funny here. Oh goodness, here we go. Let's see where we at there. Nina's going to pull it up for us. There we go. And I don't see a lot of questions. So that's what I was wondering if I was missing them. You can type them in the bottom under the Q&A. Other than that, it says no volume. I think that's the old one. Okay, that's good. So we'll just wait a couple minutes and see if any pop up. So again, I want to thank Carmela again. I mean, I was so nice of her to do that and you know, talk about it. So I think it's just really interesting to think about the fact that, you know, you can really keep your face from aging. I do have some of her before and afters as well. If you come in for some of the consults, we will let people see those. We had a lot going on at the office this week, so we kind of kept those. It seems like she was in pain by using the meds. No, it's not really. She wasn't really in pain. It's more she told me she felt some heat on your brow bone. It can up here. It can ting a little bit and feel a little bit hot. But the Pronox is really great, honestly. I think it's really, really good. So I think that is something that is really great. So we don't typically medicate you for it. If you have high anxiety, I may recommend that, but the Pronox is really, really great. And we can also put the little nose clip on, and then you're really like kind of floating a little bit, which is great. How well does the treatment work for festoons? Festoons are hard. You know, I actually have festoons. You can see it. So I think that, you know, you can help push them down. I do think some secret RF is really good there, and you definitely have to be careful who does filler because your little festoons can want to grab that liquid. I myself have that, and that's kind of why I have a break in my mylar crescent. So it's just something, you know, everybody has a little something. We can work on that though, and we can localize it to that and see. how painful is the treatment? I don't really get complaints when people are doing the Pronox. The nose clip really, really, really helps. The Pronox is extra. Yes, I'm sorry, it is $50. If you get medicated and have a driver, there is no charge for that. The cost of lower face and under the chin is somewhere around $2,900. So it's kind of this way. And then you're going to get under the eye or around the mouth a little extra free. So your submental is going to be kind of where your neck attaches to your head. Yes, I definitely do women over 70s. And also what's nice about it, there's a lady who's done it with me, and she feels it has kept her from aging as well. And she's not done a ton of filler and things like that. So chin implant 25 years ago, it is safe. I'm not really going right here. So we can talk about that at a consult, but we're not typically treating here mainly because of the nerves in your face. So underneath, yes, but not. So as long, nothing, we don't want metal implants. We don't want anything electrical in your body, things like that. So I would have to say with certain ages, I kind of need to see you because certain people at certain ages look differently than others. So I'm just not totally positive. But again, consults are free. You can come in. I am here on Saturday. The desk is available to make some appointments for you tomorrow. I may have Sherry reach out and try to, for me to come in and call some people tomorrow. The cost of the, when you're doing the ocular area, it's usually around 1,100, which is under, out here and above. If you just do above, I would have to kind of calculate that in my brain. Most people don't just do that, but we could. It would be something that I can kind of customize and calculate just for you. Do you numb with? I can put numbing cream on, but truthfully, the Pronox is so much easier unless there's a reason that you just can't do the Pronox, but we can do numbing cream and it would help with the 1.5, which more than anything, the deeper ones, it doesn't get down to it too much. It is just uncomfortable, not pain. Yes, I would say that is true.
Can I speak to the?
Yes, please.
So I just had my treatment done a couple of months ago, and it wasn't a walk in the park,
Right.
but it was nothing that I could not get through. And I did not take any type of pain medication, and I didn't do any Pronox. So I was able to get through it. And I think that's another thing too, that everyone is going to be so different. I've seen people just lay there and take a little nap, and then I've seen other people that were more uncomfortable. So
Right.
It just really depends. And I think having somebody that knows how to do the treatment and really be able to read that ultrasound is so important. Because if you're not, if you're firing energy into the wrong layer, that's when pain comes into.
True.
So,
yeah. In other words, you don't want to be using a 4.5 depth if you're firing into muscle. You want it to be into a collagen level.
that's when it's painful.
Someone's saying that they have bags under their eyes. They aren't dark and would love to get rid of them. Would Ultherapy help? Again, I'm sorry, I have to see you. I hate to say that to you. Sometimes we do recommend you to surgeons. We have a lot of wonderful plastic surgeons we refer to. They're really great. And so we can do something like that just for you to get an idea. Sometimes they have to make a little incision under the eye and pull the fat bag out and then attach back up. So it's typically something that you would notice that's maybe like your aunt has, your mom has, somebody like that, and it's really not that big of a downtime to see one of them to have that done if it's really bothering you. You can Botox with it. Botox freezes. So it makes it so you can't wrinkle the bed sheet, right? If you think of your little face as a bed sheet, if you're constantly squeezing and wrinkling it, you're going to start to depress that into the skin. So I think combining it together is a really good thing. It does help nasolabial folds because it's going to move back this way. What I try to do is stay off of this beautiful, fat pad that we have. Nobody wants that flattened, but it's always nice to sort of get back this way a little bit, which then takes the weight off the nasolabial folds. You can also have some filler done up in this area by the physicians and Annie. And that's typically Voluma, depends on what the injector's like, but it will do some of the back filling of the face and lift your face nicely to kind of give an extra boost. But again, the Ultherapy is helping with the collagen underneath. So the two together is really a nice outcome. Does full face include the eyes? Yes, it does. When you come for consult, should we wear makeup? You can, because we're not really talking about dark spots or things like that. I'm just basically looking at the symmetry of your face and I'm hearing what you're asking for and things like that. As long as they're not metal, correct? Like that's about, I mean, yeah, dental implants are okay. You just don't want them to be anything metal. So anything like that. So I know.
Like working around the mouth area.
Yeah.
If I want to put gauze or
Yes.
something there, that's what I always do.
Yeah, I can put
Just
some,
to protect.
yeah, up underneath. Yeah.
Mhm.
So it looks like that's pretty much the end of some of the questions. We will have Sherry giving you guys a little bit of calls and things like that and let you kind of see, you know, if you want to schedule anything, I'm here Saturday. I am in our Westlake office. I do consults there and Willoughby as well. So I want to thank everybody for taking time out of their busy schedule and thank you for coming to hang with me, and obviously Carmela, because she's the best of them all. So I really, really appreciate her offering to come and help me as well. So the other thing you can do is email me, jill.g@theparkerclinic.com, and we can go over any questions that way. And hopefully I can also see you virtually. You can do a virtual consult if that helps. Some people I know live out of state and come back in and out, snowbirds and things like that. So thank you very much. I hope you guys have an awesome Friday tomorrow, and we will see you again. Any more questions before we sign out? I'm just making sure everybody understands everything well. Okay, I think we're okay. All right, thanks everyone. Have a good evening.